Good. So I need some here. Are you there in our pocket? You shall later check the chest. The chest is not rising and falling. Okay, so that means your patient is in respiratory arrest, which is an improvement. So now,
What can I do for you, ma'am?
30, 40, 50, 60, 70, 80, 90, 20, 21.
Then slide your fingers into the groove just to one side of the trachea.
Child is any patient that is age 1 till you're about seeing sign of puberty.
Like airway protection, life-saving intervention like rescue breathing, life-saving intervention like CPR, and then life-saving intervention like defibrillation, delivery of a shock using an AED. And then while at this, we are not bogging ourselves down with what could have been the cause of the arrest, because that would be the next level when we escalate that care. Use AED without causing a disruption. And that will form the basis of our next practice. So we're going to be working as a team. That was emphasized earlier today. So let's form a team now where we use pocket mask as a lone rescuer, simulated as you say, call it activate emergency response, get an AED. But you start, and we ask somebody to bring AED and BVM, and the person is waiting. And once we are okay with your lone rescuer CPR, we give a go ahead. He appears on the scene, and the two of you start practicing. So maybe, maybe you guys demonstrate that first, and then we can now put it together for the participants. So we're starting off. Okay. So this is our first rescuer. We were just going there to fix something in that ward, and he observed that, and then tapped the patient. He called for help. While waiting for a response, he commences lone rescuer CPR. So this is a response who came in. You make an appearance first of all. How can I help you? So he's going to say, activate emergency response, get an AED. So you go back, and until I give you thumbs up. So, but while he's away, he continues high quality CPR for a lone rescuer. Do you understand that? Okay. When he comes in, we assume that this guy is tired now. So you're going to take the AED and start using while you take over compressions immediately. So you can move to the head of the patient to show that immediately after AED use, you are also using BVM. Do you understand that now? Okay, and just see this, you are going to see a flow, seamless transition from lone rescuer to multiple rescuer scenario, and incorporating an AED and BVM in the best interest of the patient with minimal interruption not exceeding 10 seconds, which is what is allowed. So that's what we're saying. All right. So here is a 28-year-old lady who has come for a procedure, and she complained earlier of tiredness. So the team felt she will overcome that. Unfortunately, it got worse. Now she's unconscious, but luckily for her, you walked in just right on time. So start by doing what you do in an actual emergency.
Okay. It's in a safe.
So you come. You are doing your thing now.
Hello, are you okay? Can you hear me? Hello, ma. Are you okay? She's not responding. Help!
No, wait.
1,000.
Okay.
1,000.
So how can I help you?
Please activate emergency response and get me an AED.
Okay.
So no pulse, no breathing.
You hold on.
So I will commence CPR immediately. 1, 2, 3, 4, 5, 6, 7.
So
8,
he's
9,
doing there as a lone
10,
rescuer.
12,
Can you see that the patient are better off in this arrangement? So you don't fall down and say, I have to run waiting for help. Okay, while waiting for help, blood is flowing already. And as a lone rescuer, because it's going there, good.
Continue compressions.
Okay. Did you see that? So the next person delivers these 2 items and takes over compressions immediately. So he has been delivered 2 items, but the first one he will use is AED. Can you see the way they are placing the pad without stopping each other and without stopping compressions?
Stop CPR.
Stop CPR.
Clear for analysis.
Do not touch the patient.
What are they avoiding? Danger of the... No, night. Good.
Continue CPR.
Charging. Stay clear of patient.
Stay clear of patient.
Deliver shock now.
Clear.
Press the orange button. Shock.
Clear resume compression. Very good. So,
CPR.
yeah. Do you see that now? Is there any interruption now? No. And now we have 2 rescuers, and every 2 minutes they will switch role. But this guy will be tired, he will come to the head. This guy is refreshed, he will go to the side. Do you see that? Okay. So this is what we're going to pair up, and every pair will perform like this. So that I'll be happy that now you can. All right. So stop.
Yeah. Compress.
So their patient is now alive and well. Let's clap for them. Yeah. Oh, yeah, form your team now. Yeah. Okay. Yeah, exactly. Perfect. Yeah, very good. So, yeah, exactly. Oh, yeah, let's cross pair. Yeah.
One at the back.
Yes, yes, extreme. Oh, yeah, pair them up. AY.
Sir.
Yeah. So you are pairing up with doctor there. Okay. Oh, yeah. So where's your mouthpiece? And then your pocket mask. So let's fold. Come, bring this. There's a skill that I want you to. You know, this is inside the mask that can go in, but this is the way it folds there. It folds like this so that it can go in here. All right. So everything goes in there, and then closes. So now, when you want to use this and you bring this out, this is the way to activate it. So you place your two thumbs here. You see that? And pop it to shape. You understand that? So let's fold it, and I want all of those details come into play now, because in real life that's the way they're going to be happening. And just stay calm. Patient is better off when you are calm, and if you rush too much. So this is your pocket mask. So let's say you go with it, yes, inside the upper this pocket. Yeah, good. So all right, so this is your scenario. You carried out the procedure on this patient 2 hours ago. You were moving around to see if they're fine. Then you enter the room, and then you observe an unusual silence. Then you ask her, "Ma'am, are we great?" No response. So start by doing what you do. Then actual emergency. Yeah. Yeah. Scene is safe. Yeah.
Ma'am,
No response.
no response.
Yeah.
Help!
Good. So I need some there. Are you there in our pocket? You so she's checking. Okay, yeah. So, so go now. Go now. So what can I do for you?
What can I do for you, ma'am? Activate the emergency response. Get me an AED.
Very good. So calm down.
Nice one.
Just wait until you get the next prompt. So go from here. Just yeah. Good. Yeah, prompt.
It's very patient.
Okay. So that patient now is enjoying a lung rescuer compressions. Blood is flowing now. We are happy while we are anticipating help.
Okay.
Hold on. I want a single complete cycle. Okay. So our pocket mask is telling us that even while waiting for BVM, the patient is still getting some level of oxygen. 1, very great. 2, excellent. Continue compression. So hand over the AD to us. Say, here's the AD. Okay, so take the AD and you say, I will take over compression. So, oh, please, hold on, stop a bit. So if you are the second person coming, wait. The second person coming, you must make those two statements. Here's the AD, I'm taking over compression. So I say that. No, I get it. Just say it.
Here's the AED. I'm taking over compression.
Okay, very good. Excellent. So move to the head.
Arm placement.
Hey.
Yeah.
No,
Continue.
yeah, at the center. Yeah. So, no, the first step. No, don't do that. The first step, because in your exam, let me just give you an ojoro. So they may ask a question. Jesus spoke in parable, isn't it? What's the first step to operating an AED?
By turning it on.
Very good. So in practice, that must always be there. So continue compression. You don't be interested in what she's doing. Just focus on. Very good. Yeah.
Apply pads to patient's bare chest.
Very good.
Plug in pads connector next to flashing light.
Tired.
Yeah.
Apply pads. Plug in connector.
Very good. No, I'm happy. That's playing out real life. You understand now? Because the AED said, and she's listening to the AED. Okay.
Don't touch the
Yeah.
patient.
Tell her. Say stop. Clear.
Shock advised.
Okay. Continue compression while charging.
Stay clear of patient.
Just say clear. Wait. Okay. So look around and say clear, everybody. Oh, yeah, press the shock button. Shock deliver. Resume compression. So I need you to balance yourself now. Be in line. Yeah. In straight line with the patient. Straight line. Yes. Very good. Yeah. And then your C clamp. So you will count out loud now so that you will know when to give breath. Okay, so don't worry. So that's why we are relearning. No.
No, you don't take over.
You don't. No. Go back. Don't switch. Sorry. See, let's pack this one more. Pack this one more. That's the essence of the training. Don't worry. I want you to make your mistake. Okay? Make all your mistakes now, and that's why a single skill we are practicing them over and over in different scenarios.
Extend the neck.
Yes.
Continue. Count as loud you can hear. Extend the neck. Press. 1, nice on. 2.
Resume again. 1, 2. So you are going to do a full set until the AED speaks up again. Because in real life, that's what you are going to be doing.
1, 2.
Continue. No, until the next 2 minutes. When the AED speaks. But did you notice something? She got to 20 and stopped. So that's why we say count out loud. So it's up to 30.
One, 2.
Okay? Yes. Continue. And your hand.
You just need to adjust. Don't
And our hand placement is too lower down. So here, the nipple line. Good. Oh, yeah.
now. So we are doing double C. Yeah,
Okay.
press it down. Once she's ready, extend the neck.
Okay, so it's time now. Oh, yeah, say stop CPR.
Stop CPR.
Oh, yeah, come back to your position. You go to the head now. Good. So the AD says no shock advice. Wait. What will you do? We say anytime it says no shock advice, what should you do? Check the pulse.
Okay.
Okay, so you can feel some pulses. Yes. That's good, right? Yes. But what do you do? Check the chest.
Is it rising and falling?
No. Wait, hold on. Oh, yeah, let her check the chest. The chest is not rising and falling. Okay, so that means your patient is in respiratory arrest, which is an improvement. So now provide rescue breathing. Oh, yeah. No more compression. 1 breath every 6 seconds. Oh, yeah.
No, with that.
No, with that one.
Yeah, it's better that way.
So
Yeah.
the two of you turn the back towards their side. Here, oh, yeah, help her to be pushing. Let her do that. Extend the neck.
Extend the neck.
Yeah.
1,
Yes.
1,000, 2, 1,000, 3, 1,000.
1,000. 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000.
On the 6 1 instead.
1,000,
2, 1.
1,000, 3, 1,000, 4, 1,000, 5, 1,000.
Continue.
So while you are saying 2 1,000, you observe visible chest rise. Oh, yeah, remove the mask. Don't suffocate the patient. He's breathing on his own now. Okay, so what do we do? We tap her. Ma'am, are you okay? But she's not responding yet. Now she has a pulse and she can breathe. What do you do? No, yeah, roll her into recovery position. Very good. Okay, so let's clap for them. Okay.
Now you can sit back.
All right, so any observation, any question? You know, when you're in the eyes of the fire, yeah, it's not that easy. All your theory will fly off. So that's what is happening here, okay? So any question, any observation? What's your observation? Let's debrief them. How did that go? Yes.
The sequence.
Okay.
I'm still trying to.
Memorize them and be able to record them.
I went to wait.
Okay. Yes, exactly. Yes. What other observation? No, the patient survived.
The patient did not respond to like
Yeah.
We did not do the technique.
Yeah.
So like in a case that we might have done it to like apply the
Yeah.
the patient did not show us any sign of like
Yeah. So the question is saying that for how long do we carry on before we call it a day, isn't it? Okay, so we'll answer that. Let's put that in the parking lot.
Okay, and must the AED, so the
AED.
must the AED speak for us?
Yes.
He must speak.
Yes, it must speak. From Nigeria to China, every AED speaks. However, in China, you may speak a language you don't understand.
What if there is no AED?
Yes, and they say half a bread is better than chin-chin. Is that still correct?
No, it's better than none.
Okay, so you do CPR already. Okay, thank you. So now the reason being that AED has been pre-programmed to repeat that analysis every 2 minutes. Let's say analyzing heart rhythm. So on its own, the next 2 minutes is when he's going to hear the result of his last shot failed or could have been successful. But we know when the AED says stop CPR. So we can't fold arms since we have not known what our result is. So we must be doing high quality CPR for that 2 minutes. Do we understand that now? Okay. So in the next 2 minutes, AED will say stop CPR. And we say, okay, stop. AED will analyze again. And if the AED says the rhythm there is shockable, we will still advise a shock. If it's not shockable, we will say no shock advised. Okay.
The man said something.
Yes.
Not along the lead of the list.
Oh, okay.
This one is fast. It's how all of them.
Okay. Yeah. So
You should be doing what you're doing. It's saying wait, not sure.
no. You know the problem is that people don't know how to incorporate AED with compression. So we're going to simulate that now. So an average AED takes the pulse takes like 7 to 10 seconds to analyze, which is okay. Still within the 10 seconds allowed. So when they are taking longer time, maybe their batteries are going down already. Resuscitation efforts become disorganized when people don't stick to rules, and it's natural to not stick to rules. However, training tames those tendencies and ensure that we stick to rules. So don't get carried away. You see the AED, especially during AED, what was this thing that is talking? Everybody wants to have an input, then compression suffers. That's what happened. Do you understand that now? Okay. And if a role has been given to you, focus on it. Let the other person focus on for pain relief, and then she's just not talking to you when you enter the room. Yes.
I see she's not breathing.
Yeah. No, you won't know from a distance. She may be sleeping or meditating. But the first thing you observe is she's quiet, not talking to you. So start by doing what you would do. Look around, scene is safe, tap her.
Scene is safe.
Yes.
Are you okay? Are you okay?
No response.
Help! Help!
Okay. Yes. No, don't bring this here. Do you know? You don't know what it is. Yeah, continue compression. Yeah, go there and ask her. Ask him.
Please activate emergency response. Bring aid and ITDL.
Okay. So yeah, stay there. When we give you this, you right? No, wait, man. Oh, where's your pocket mask? Yeah.
That is immediately.
And then where's your
Syringe.
Yeah, syringe.
I think
Yeah.
Connect it immediately.
I died in
Yeah, compression first. 3, 4.
Count out that. 1, 2. Nice one.
Yeah, go now. Don't forget your 2 statements. Very good. So
you change position.
We say
AED.
so. Everybody listen. The teaching is use the AED as soon as it arrives.
Okay.
That's also an exam question. Is that clear now? Yes. Very good. Even if you have just started the new cycle, you are number 5. 1, 2, 3, 5, and they bring the AED. Use the AED as soon as it arrives.
Long press.
No. Don't give breath.
Continue. You continue.
No, don't. It doesn't matter.
Okay.
So at this point, we will still be doing compressions only. So the oxygen in the blood is circulating with compression until the shock is delivered. They have access to this kind of quality care.
Yeah,
they have hope.
You are not.
And you can't say all resuscitation efforts prove abortive until you have done all of this. So no response. You're not here for help.
What can I do for you, ma?
What can I do for you, ma? Activate the emergency response.
You know where to collect all your instructions.
So nice one.
Yeah, follow that beat. No, follow that beat. Yeah. 8, 9, wait, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21.
Another one.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Hold on.
No.
Hold on. Just listen. Yeah, continue the question.
Oh, yeah. So no, you said clear. Oh, yeah.
Clear. Oh, yeah. So why you go to the edge? That's clear.
Move to the other side.
So no shock advice. What do you do next? Yeah, do that. Yes, he said no shock advice. Check for pulse.
No, check the pulse. Okay, you can feel a pulse.
Sorry.
I can feel the pulse, but no breathing.
Okay.
So
So you notice that this patient is breathing on his own now. Thank you. Let's clap for them. So
And then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to the brain and heart. And to increase blood flow to the heart and brain back to the same levels.
I'm also assessing our patients. So, but we should have a procedure on doing that. Now, imaginary line across the two nipple. Nice one. Okay?
No.
Lock your elbows
Shift your
and
hand
your
up
shoulder should be straight. So your shoulder should form a vertical straight into the chest of the patient. Okay. 1, 2, ready, go. Count out loud. Please count out loud. I want to hear your voice. 1, 2, ready, go. 1.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 17, 18, 19, 20.
Let's see. 43-year-old man that's suddenly collapsed. What are we going to do in a natural emergency? So 1, 2, ready, go.
Sing it safe.
Hello.
No response.
Emergency response. Give me the AED.
Okay, check
Check
for
the
pulse.
pulse.
I'm breathing. 1,000, 2,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1. No pulse, no breathing. Okay, arm placement. 1, 2, ready, go.
1, 2. And we don't want it to be too fast on one hand. On the other, we don't want it to be too slow. So the app is what helps you to just be accurate. So you set it to 100 to 120. So let's say 110 for a comfortable mid place. 110. So it's going to be giving you the sound at that rate, and you will try and synchronize your compression. So that the next set that are coming out can practice using it.
So,
Okay? Yes. But I just press the negative so that you'll be on 110. Yeah, that's 120. So no, that negative sign, that minus sign.
This.
Yes. Reduce it to like 110.
nice one. It's as if these people have done several CPR before. That was perfect. So the second round. 1. Of course, so if this is happening outside the hospital or healthcare facility, so one of the first things you want to be doing after calling for help, you want to carry people along. Some people, they are not going to help because they are afraid that they don't know what to do. But there are some skills you can immediately teach, just like this CPR. You know, CPR is very tiring. But if someone like so just put them to do it this way, they join you, and you carry them along, you tell them the benefit of what you are doing to that patient. So I think they will join. Okay, so connect your mouthpiece. The face of the patient. Adjust a little bit, making sure this is not, just the entire mass exactly. So nice one.
So now we have turned them now, so such that to send the message that whenever you want to use the bag mask, where is the right place to start? The head of the patient. So that's what we want to practice now. So 1, 1, 1. Yes. Okay, so position the mask on the face of the patient.
Hello, ma'am. Hello, ma'am. Can you hear me? Help! Help!
What do you need? What do you need?
Please activate emergency response and all I can bring again.
Okay. I can do it.
Why you bring out?
It's not your 2 seconds.
Yes, you have to do a compression.
Nice one.
1.
Sorry.
Do not touch the patient. Alright, take no shock advised.
No shock advice. Hold on.
Begin CPR.
4, 1,000, 5, 1,000. Do it. Oh.
2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000.
Child is any patient that is age 1 till you're about seeing sign of puberty. Maybe for male patients, underarm growth, for female breast development. Once you see those 2 signs, you will start using adult for them. That means sometimes you treat what you see, not what you imagine the patient to be. Just look at the chest of the patient. Is there breast? This is breast, so that is adult. Straight up. Don't bother asking of the age of the patient. If there is none, regardless of the age you think the patient is, you just use that about what you see physically on the patient. So now, for infants, another difference you want to note. CPR for infants, the same thing for child in regarding of rescuers. If you have more than 1 rescuer, it still becomes 15:2. But if you are still alone on that infant, it becomes what? 30:2. So that means all age group is 30:2 if you are alone. And if you are more than 2 for infants, is 15:2. So now, how do you assess infants? Because adults, you tap the shoulder. But infants, you don't tap the shoulder. They are more sensitive at their feet compared to the shoulder or to the ear. So for them, once you check for safety as usual, hello baby, are you okay? Can you hear me? It sounds funny. Yes, you need to just tap hard on their feet. Hello, are you okay? If there is no response, no cry, no laughing, no body movement, you take that as not responsive. Then you shout for help as usual. Then you check for pulse. So where do you check for pulse for infants? You don't use the carotid pulse anymore. So you use the breaker pulse instead. The pulse around the elbow, in between the elbow to the armpit. So you go in there and feel the pulse for about 5 seconds and no more than 10 seconds. If there is pulse, what do you do next? That means it's not in cardiac arrest. But if there is no pulse, you start CPR. but you need to stand. Are you ready? Chest was down. 1, 2, 3, 4, 5. Yeah, let's jump that out.
When you get to the question paper, don't start it. We start at the same time. And also finish at the same time.
Come out of there.
5, 6, go.